Ghanaian startups and AI techs are harnessing AI and big data to revolutionize public health, predicting outcomes, automating diagnostics, and digitizing records. These innovations hold immense potential for Ghana's healthcare, offering improved access, accuracy, and outcomes that could be a game changer for the country's health future. One such startup or health tech is MinoHealth AI, a growing AI health tech company currently in Ghana, which is broadly exploring AI and exponential technologies in healthcare in the area of AI and big data in healthcare systems. Darlington Akogo, a global leader in AI, is one of AI gems currently in Ghana in the area of artificial intelligence and big data. He explains what AI is all about and how to leverage it in the area of healthcare and big data.
The whole goal of AI is that how do we take this intelligence that we see in humans, but not limited to just humans, even in animals, and embed it in machines. So that's the central goal of AI. And the big data part, essentially, we're doing something called machine learning, which means that we want to teach machines the ability to learn from data and be able to perform tasks. So essentially with big data, the goal is being able to accumulate large enough data in journalism, in medicine, in biology, and then using it to train AI systems. And in healthcare, essentially, once you do that, you can have AI systems that can diagnose diseases. You can even have AI systems that would design new drugs. So that encapsulates AI and then big data too as well.
Ghana's healthcare sector faces challenges like inconsistent records and delayed diagnosis. AI and big data can bridge these gaps by enabling faster and data-driven decisions to support healthcare professionals.
If you look at the numbers in healthcare, globally we have a shortage of 40 million health workers if we want to achieve universal health coverage, which is part of the SDG goals, which we only have 5 years for. So in 5 years, we have to create 40 million health workers. It's not feasible because training 40 million health workers around the world, medical school is no joke. In addition, if you come to our side of the world, it's actually quite scary, the numbers. In Ghana, our doctor to patient ratio used to be 1 doctor to every 10,000. Now it's improved, it's like 6,000, 7,000, 8,000, depending on the source. That's not the worst. The worst is Malawi, is 1 doctor to every 60,000 people. So how do we expect, these people that have dedicated their life to saving the rest of us, keeping us alive, how do you expect one person to manage the health of 60,000 people? In Ghana, for example, if you take radiology, we only have 100 radiologists in the entire country. So that's 1 radiologist for about 300,000 people. So looking at all these numbers, training doctors is essential, but that doesn't solve the problem. And so the whole goal with MinoHealth AI Labs is, can we train AI systems to perform really well across different tasks in the healthcare pipeline? And then have those AI systems serve as medical assistant to the few existing specialists, general practitioners, health workers that we have both in Ghana, in Africa, and globally.
Big data encompasses vast information from clinics, hospitals, apps, surveys, and weather patterns. Artificial intelligence, AI, leverages machine learning algorithms to analyze this data, identify trends, predicting outcomes, and informing decision-making.
So we have essentially this generative AI system called Moremi AI. Moremi AI is a general purpose AI system for healthcare and biology. What that means is that within one AI system, you're looking at hundreds and even possibly thousands of tasks. So the AI system can do radiology, as we talked about. You can look at over almost all the imaging modalities you find in radiology. It can write medical reports for them. So you can give it a mammogram to generate a medical report for you. You can give it an X-ray, CT scan, ultrasound to do that. Then you can go into microscopy. So for example, for certain diseases, we need to take blood samples, put it under a microscope. The AI system can analyze that microscope. Do you want to detect malaria, sickle cell, or is this some other hematological or blood-related disease you want to detect? The AI system can help you do that. Across different modalities, imaging modalities, about 30, we can process lab data, we can process text, we can process your medical record, do all of this to be able to perform screening, diagnosis, and then prognose, triage. So we can tell not only what you have now, we can focus what you might develop down the line. We can say if you've already developed this, what is it going to look like in the coming weeks, months, or years? How is it going to progress? Or if you have too many disease people, we can have the AI system do the analysis and tell you whose own is much more severe and need to be prioritized. And this is all just under healthcare. We can do this for communicable, non-communicable diseases. Then if you go into biology, the AI system can help you design new drugs. So you can use it to create both what we call drugs, antibodies, and vaccines. So the entire process, and there's so many things that goes on in there, is all done by the AI system in a very automated, autonomous fashion. So yeah, that's even all what I've said is still just a fraction of everything the AI system can do.
Like MinoHealth AI Lab, a pioneering Ghanaian healthcare startup which is harnessing AI to predict diseases, diagnose and recommend actions. It is based in Accra's Kwabenya suburb. The company uses AI-powered image recognition tools to support diagnosis in clinics and hospitals, including the Kolebu Teaching Hospital.
Yeah, with Kolebu, the main details was we did an early pilot with them before we actually rolled out the system. So we gave it mainly to the radiologists to see based on what they were personally detecting versus what the AI system was detecting. And then we actually put together a paper. So in the paper, we took data from a couple of facilities. We have a couple of radiologists from Kolebu, but also other institutions that were involved in it, like University of Ghana Medical School and some private facilities. When we tested the performance of the AI system, we actually realized that this is a different version, so a different version than what we currently have, but essentially the performance matched a group of radiologists working together. So if you put together 4 radiologists, you get the AI system matching their performance. That is what we got. And we didn't even limit it to just data from Ghana or just working. We even took data from, Vietnam and also the US, combined it and then tested it with the specialists that you have at Kolebu, University of Ghana Medical School, and then a bunch of other places. With the new version of our AI system, I think when I last checked, it's basically address 10,000 medical queries.
MinoHealth AI is harnessing early diagnosis and patients' outcomes by significantly reducing the time between testing and treatment, with notable advancement in radiology.
We already have it in a number of hospitals. With the public health facilities, well, definitely we are working with the different agencies to kind of expand nationwide. But this is already something that is being used not only in Ghana, but in different countries, in different hospitals. So it's very much already here. The way it helps with the public health sector essentially is that is where the need is even greater. If, for example, you go take a mammogram, if you do this in a private hospital and you go to a diagnosis center, a private one, you might be able to get your results maybe even the same day in Accra. Right? Once you move away from Accra, it gets a bit more difficult. In the public health system, if you go to some of our largest public health hospitals like Kolebu, due to no fault of the facility and the people in there, it's just they're overwhelmed. You're looking at that taking you several days to weeks before you ever see your report. And for certain things that are life-threatening like cancer, delays are dangerous. So with the AI system sitting within public health facilities, we can make it so that essentially that instead of the days to weeks, the AI system can spend just seconds to detect that. That's what it currently does. In less than 5 seconds, you get a medical report. And the pricing is also reduced, which means that the burden of public health to the country reduces.
Ghana's public hospitals still rely on paper records, but startups like MinoHealth is digitizing healthcare with AI-powered electronic health records. MinoHealth is collaborating with the Ghana Health Service to leverage big data, reduce cost, and improve diagnosis and outcome.
This is essentially the new normal. So if you're a young person, you're not taking advantage of it, you'll be made so obsolete. It's going to be quite scary. Right? Like, we are seeing this happen in every field. No field is spared. We are seeing this happen in media. There are videos being generated by AI system. There are photos. Even those who are building the AI system, we are seeing it happen. We now have AI systems that can write code to build other AI systems. So if you're not using AI systems, essentially you'll be removed from the ecosystem. Which is why, as part of the national AI strategy, we're saying that we have to aggressively train young people within the country. I think we already have the 1 million coders initiative, which is amazing. That's impressive. We need to embed this into our curriculum from a young age. You don't need to wait for people to get to the university, because essentially they are going to grow up, or they are going to enter into a world which is AI everywhere. So even if it's primary school, you don't need to learn how to start building AI systems in primary school, even though there are ways you can teach that. But at least let them start understanding the concept of AI, learning how to use AI primary school. By the time they get to junior high, senior high, they are well versed and they can become globally competitive.
MinoHealth's platform is expanding into quite a number of things across the healthcare space, which include radiology, ophthalmology, microscopy, hematology, oncology, and to the discovery of clinical genomics that takes a patient's sequence data, that is information about genomics. However, challenges persist, including limited internet access, inconsistent electricity, and digital literacy gaps.
Even for us, every time we discover new things, not too long ago, we discovered clinical genomics, which means that if we can take your sequence data, information about your genetics, pass it to the AI system, it can process it and then tell you, for example, your likelihood of developing certain things, certain specific cancers. What is, you can say, for example, there's a 70% chance you develop this type of cancer within the next 10 years, and then come up with recommendations on how to reduce that risk. All of those within the same AI system. So it's quite vast, the different things that we cover. We're even working on a new version of the AI system that would be even much more powerful than what we have. So on the technical side, definitely we'll keep improving the AI system. We want to get to a point where the AI system can be trusted. Like right now, it needs supervision, but there are certain parts of the world where there's even no one to supervise that AI system. Whatever we are talking about, it always comes back to, electricity and internet, right? Because those are the infrastructure within which the modern economy is built on top of. You can sort of hack your way around it, but it doesn't solve the solution. So,
additionally, AI solutions raise critical concerns about data privacy, security, biases, and ethics that must be addressed.
Ethics matters a lot. And so if you have powerful technology, usually they can be dual use, which means double-edged sword, for good and for bad. So you need to put in measures to make sure they are not abused. So there are data protection laws in the country. We abide by them, heavily compliant with them, certified by them. You also look at ethical frameworks that you adopt. We both work with different institutions globally, even with the UN, to look at designing frameworks when it comes to ethics regulation for AI, and then we definitely implement those. Ghana is actually very developed when it comes to regulation. So our FDA is level 3 or level 4, one of the highest within the African continent. Policy is a different, and we need to be much more aggressive in our adoption of technology. Ghana Health Service has been doing quite a lot of work when it comes to adoption of technology. Yeah, it's impressive, but then also we need to be much more ambitious when it comes to things like AI, which is what we are currently working on with some of the departments within Ghana Health Service. If hospitals want to adopt solutions that will actually save lives, the government could offer them subsidies, but that's just one idea. We could essentially come up with strategies that say that in the next 10 years, we want to make sure that every public health facility within the country, one has access to internet and is using AI systems.
Ghana is emerging as a health tech hub in Africa, driven by institutions like KNUST's Responsible AI Lab, growing development communities, and government support. AI techs like MinoHealth AI Lab is pioneering local solutions that can drive lasting impacts.
Essentially, people adopt what they need or what they want. If they don't want it, you would know. No matter how much you spend on it, it will just die out. They will stop using it, they won't use it. So definitely having communities, local communities tell us what they need is an essential way of achieving this. But also, it needs to be a blend of patients, but also the health workers. Because if you ask anyone, what do you need within healthcare, they will give you the perspective from a patient, which is important. But we also need to listen to our health workers because they know more about our health than even we do. So for example, we do a lot of work engaging with health workers. Almost everything we do over here, we always contact health workers, medical doctors, specialists to check it out, to let us know if this is the right thing before we even proceed with it. But yes, I agree, because if you don't do that, in the past, what used to happen is that development partners will just take some solution from Europe or America and come and dump it here and expect us to use. First of all, it doesn't even solve our problem because it's not fine-tuned to our needs. There's also the capacity aspect of it, right? We don't build any capacity, we are only recipients. So yes, making sure that we have the local community involved and influencing what we want as a country in AI is of the utmost importance.
With strategic partnerships, Ghanaian AI startups can tackle the country's toughest health challenges and potentially create scalable modules for the rest of Africa.
In the next 5 years, definitely by then, we should have progress enough with Ghana Health Service. I would personally want to see in the next 5 years that AI is being used entirely across our public health centers, right? We shouldn't have any public facility in 5 years that one way or the other is not leveraging AI to improve the quality, access, and affordability of healthcare to Ghanaians. So definitely in 5 years, we should be able to close that gap. In 10 years from there, the technology should become so advanced that we can have AI systems essentially even in the tiniest of health facilities in the remotest part of the country, but also even going beyond that to the point where they are now sitting directly with the patient and helping them. So it's kind of like in certain sectors, a supervisor sits back and you have a dashboard that will show you everything that is happening in all your centers. Healthcare should come to a point where it's something close to that in 10 years. You have the AI systems. Essentially, all of us have our AI systems with us. They're checking your health, improving your health. And then you can have medical personnel sit back and then just look at the summary of all this data. If anything is flagged, then that will be addressed. If not, let the AI system continue its work. So there's no limit to how far the technology can actually go within the country. And I have no doubt that in 10 years, we should be able to get there.
AI solutions in Ghana's healthcare require a balanced approach, combining innovation with ethics, infrastructure, and inclusive policy. When harnessed effectively, technology can help leapfrog traditional barriers, enabling timely diagnosis, efficient treatment, and reduce healthcare costs.